So yesterday we talked about P1 and P2. So basically in P1 we have six plants, okay, which mostly work from nose to upper respiratory tract. Okay, so whatever problem related to this area, you can give P1 or add P1 with other necessary remedies. Next we have P2. In P2 we have 10 plants which work mostly on alveoli, bronchi, second tertiary bronchi, and lower respiratory tract. Okay. Because it is respiratory remedies or respiratory system remedies, systematic remedies. So we are selecting the organs and their related organs. Okay. So here now we will talk about P3. P3 have 9 plants. Okay. P3 have 9 plants. Number 1, Adantium capil veneris, same plant which is present in P1, P2, and P3. Adantium capil veneris. Okay. Next we have second, Uragauga ipicau Kaukanha. Urgoga ipicau canha. Very different to pronounce. Palendrium aquaticum, same plant which is present in other remedies. We have poly, Polygala amara. Polygala amara. Okay, next. Fifth number, Ilium cepa. Ilium cepa, this is the common remedy in all P1, P2, P3. Eclamptus globulus, this is also seen in P1, P2. Next, we have another remedy, Drosera rotundifolia. Drosera rotundifolia. Okay, next we have eighth plant, that is Hyoscyamus niger. Hyoscyamus niger. Hyoscyamus niger. So these are the 8 plants, and ninth plant which is present in P3, that is Hydrastis canadensis. Okay, Hydrastis canadensis. So these are the plants which are present in P3. Okay, so where does P3 work? So it works on outer layer of respiratory system. Outer surface of respiratory system. So what are the outer surface? We have pleura, pleural membrane, okay, covering of lungs, okay, and we have mostly alveoli, okay, alveoli will, we have alveoli covering, that is a mucous membrane. So way that P3 works, okay, and we have mostly it also work on pulmonary muscles, which are attached to the intercostal muscles. What we call intercostal muscle, between the ribs we have muscles which help for breathing, respiration, inspiration, expiration, everything. Okay, so this is the function of P3. So, but mostly it is advisable to give children and women. Okay. P3 is advisable to give children and women. So that is the reason we advise P3, P3 for mostly children and women. And as well as we can apply externally P3 because it will work on smooth muscles of respiratory system, intercostal muscles. Okay. So if a person have whooping cough and bronchitis, TB, pneumonia, pleural effusion, all these problems, they need external application also. So we advise P3 BE to the patient, P3 plus BE, P3 BE. So you can give P3 BE internally and externally also is the best for all types of cough, whooping cough, and we have pneumonia, bronchitis, everything can be treated with the help of P3. So other remedies you can add with P3, those are C13, okay, C17, okay, and other than that, F1, S1, and remedies with P3 are here, and electricity is BE and GE. So we need BE and GE for P3. Okay. So P3 works mostly on covering of the lungs, muscles of the lungs, and alveoli, covering of the alveoli, mucous membrane. So there it works wonderful along with BE externally you can apply. So you will get wonderful results. Okay. This is all about B P3. Now we will talk about P4. So now we'll talk about P4. So basically P4 have 8 glands. Okay. What are those? Adentum capil veneris, same plant present in P1, P2, P3, and as well as P4. Next we have Urgoga ipcaconha, same plant, the different pronunciation we have. Third number, Palendrium aquaticum, Palendrium aquaticum, and fourth number is Polygala amara, and fifth one is Allium cepa, sixth one is Eclamptum globulus, seventh one is Aconitum, which is present in F1 also, eighth one Arnica montana. So these are the specialized plants which are added in the P group, Arnica montana and Aconitum. So there is the reason it is specialized for nervine effect of nervine effect of lungs. Okay, it supports not only the function of lungs but also through the brain. So basically, we have central nervous system. In the central nervous system, we have respiratory centers here. Okay, so that's the reason it will act nervinely to the lungs. Okay, so basically, due to the effect of Arnica montana and Aconitum. So whenever a patient have asthma, severe issues like asthma, chronic pneumonia, chronic bronchitis, whooping cough, TB, okay, at that time you can advise P4 to the patient. That lungs problems which are chronic in stage. So it will work on the lungs also as well as through the brain. Okay. So there's the reason P4 is given to the chronic obstructive pulmonary disease, COPD, chronic cough, smoker cough, and old age cough. So at that time, you can advise patient P4, it will work wonderfully. Okay, like dry cough also, asthma. Also during asthma attack, you can as well P4 to the patient. It will give wonderful effect. It will decrease the cough and increase the lungs capacity. Okay, improve the lungs capacity for breathing. Okay, so this is all about P4. What are the good remedies, best remedies? Along with you can use P4 with C17. This is the wonderful remedy for all types of chronic and especially TB of lungs. And you can use with F1, S10, okay, when one, any congenital effect of lungs, genetic effect of lungs, and along with RE and YE. So you have to use P4 with YE and RE, then you will get wonderful result. So P4, F1 to improve the mostly Nirvana effect, S10 for metabolic effect, N1 for genetic effect, C17 to remove the toxicity from the lungs. Along with P4, it will work RE, YE, electricities you can use along with P4. Okay, so these are the original remedies which are present in P group. We have P, we studied P, P2, P1, P2, P3, and P4. Now we have P5. So P5 is a compound remedy. So that's the reason it is removed by the Dr. Count Cesar Matti. We have P2C5N1. What are the remedies which are present in the P5? P2 plus C5 plus N1. So it is a wonderful remedy which improve functional efficiency of the lungs and for allergic rhinitis, allergic asthma, you can use, and it will work on the cellular level of the metabolical effect of the lungs. Okay, to improve the quality of the lungs, and as well as for inhalation, we need lung to work properly. So overall, it will improve the functional efficiency of lungs. Functional efficiency of lung. So this is the basic function of P5. Next, we have P6. What are the remedies are present in P6? P1 and C5. P1 plus C5. It will reduce the inflammation of the lungs. Inflammation of lungs. What it works like we have bronchitis, okay, and we have alveolitis, bronchitis, tracheitis. So it will reduce the inflammation and it will work on cellular degeneration of cell of lungs. Cellular degeneration of lungs. So you can use P1, C5, reduce the inflammation, reduce the degeneration of lungs, and it will improve the regeneration of the cell. Next, we have P6. After P6, we have P7. P7 have P2, C5, A1. P2, C5, E1. So it will work to strengthen the capillaries of the lungs. Okay, to strengthen the capillaries of lungs. So at the time of blood warm, blood cough, Okay, or during TB or other disease, if you have uh, bloody cough, so you can use P2C5A1 and it will strengthen the capillaries of the lungs. Okay, so this is the use of P7. Next we have P8. P8, it will work on P2. It have P2, C5 again, and F1. Okay, it promotes to promote nervine efficiency to the lungs. Nervine efficiency of lungs. So if the problem from the respiratory centers to the lungs, so you can use P2C5F1. It will improve the connection between nerves and the lungs. Okay, so it is very good remedy. Next we have P9. P9 is combination of P1, C5 and F1. Again F1, C5 is there, but here P1. It stimulates the respiratory center, stimulates. So if the issue is like P2, we have in the P8 we have P2, we just have P1 here. It will give stimulation to the lower respiratory tract. P1 C5F1 stimulates the upper respiratory tract of the respiratory centers and it will decrease the cough also. Okay, like we have rhinitis, allergic asthma, chronic bronchitis, irritative cough. So, so at that time you can advise F1, C5, P1. Stimulate the nervous system for upper respiratory tract. P2 for lower respiratory tract. So I think you understood about P group overall. P group. P1, P2, P3, P4 is specific for they have P1 for upper respiratory tract, P2 for lower respiratory tract, alveoli and bronchi. Again, P3 for overall structure of the lungs, covering of the lungs, bronchial covering, or alveoli covering. So that is the reason it is wonderful remedy for children and women. And P4 for old age issues, chronic issues of the lung to give the nervine effect. Okay, so that is the reason we have P4. Okay. So this is the good. So along with all remedies, you can use C13, we have C17, F1, okay, S1, S10, RE, okay, YE, DE, and G. Mostly with P4, you have to use REB, YE, with P1, P2, P3, BEG, and P3 and B is wonderful remedy for application. External application, external hot compressor you can give for the chest patients because you uh, also work on we have muscles, respiratory muscles which help for breathing. Okay, so we'll conclude here only. If any doubts, kindly ask. Thank you.